Good afternoon, everyone. I hope you liked that song, Say My Name. First of all, let me tell you what my name is. So that was Say My Name, and that was by Destiny Child. Do you remember Destiny Child? Oh my God, back in the day. That song was lovely. I really enjoy that. So you are listening to the Black Health Initiative Show with Passion Radio, and my name is Lesley. Woo-hoo! And I am so happy to be here with you. This is our third week already. 3 weeks have gone by. I cannot believe the time is going so quickly. It really is, and I hope you are all enjoying the show. Our first show, we were talking about blood. Our second show, we was talking about dementia, and our third show, we are talking about I can't say the word. I can never say the word. It's not infertility, it's fertility. Oh my goodness! I've got to put my teeth back in to say that word. So let me just tell you a little bit about BHI. So BHI is Black Health Initiative, and we have teamed up with Passion Radio, and we are on this radio station every Thursday at 2 o'clock till 4 o'clock. It's the BHI show. And then straight after myself, I have got DJ KC on the show, and she is here from 4 till 6 p.m. So tune in every Thursday, BHI show, 2 till 4, and then DJ KC, 4 till 6. Woohoo! And if you want to get involved, I've got my host, my co-host in the studio with me. It's Marcia. Hi, Marcia.
Hi, Lesley. It's really always good to be here. It is. I love being here, yeah.
Excellent. No, it's really nice. And I hope you've had a really nice week. How have you been feeling? What have you been up to?
Oh, this week has been just busy. Getting prepared, for.
Don't say it.
No.
Okay.
Not for the. No, I'm not. I don't kill up myself over Christmas. Trust me. I'm more bothered about making sure that I've got things in place. Making sure that my goals, and the things that I want to do for the coming year are in place. When you kind of running your own show in a way, your own business, you want to make sure that you put those plans in place. So
definitely.
That's those goals.
Yeah. Goals are so important.
Yeah.
Sorry to cut you. Go ahead.
No. I was just gonna say just exactly that. Just having your plans. They're not sort of rigid because they're kind of flexible, but at least there's a direction and a bit of a strategy behind everything.
Yeah.
So yeah.
Say the word. What was I trying to say? Just tell our audience who our guest is.
Oh, our guest it's Angela Barrett or Pauline Barrett.
Yeah. And she's going
to be talking about fertility health.
Yeah. Wow. It's like, we said it between us. Thank you. And we're gonna go to Pauline shortly. Pauline, she's not in the studio with us, she's online, but we're gonna talk to Pauline in a minute. Let me just tell our audience about BHI. So BHI is like I said, Black Health Initiative, and we've got a few different projects going, but one project which is starting in January, it's the BHI Soul Steppers. Woo-hoo! Let me tell you all about it. So it's for any age, and it's a walking group. It's for all genders. It's to take part. It's about looking after our well-being. Yeah, it's about being a part of, sometimes you might not want to go out walking by yourself, or you think to yourself, you know what, nobody's there to hold me accountable. Well, let me tell you, BHI Soul Steppers, we are there to hold you accountable. Yeah, and it's about looking after your well-being, staying healthy, making sure, you're doing some exercise, some movement. Because when we had that discussion last week, Marcia, regarding dementia,
right,
they were talking about, to keep to keep your body moving, to do some gentle exercise. We're not asking you to run a marathon. We're asking you to do some gentle exercise to keep you active.
Absolutely.
To keep your heart going.
Yeah,
basically.
It's important to have some movement. I mean, I think there's some new terms that they've got now, like embodiment and somatic things that we're doing. And basically all that means is that, there's an acknowledgement that we need to keep our bodies moving.
Absolutely.
And joining the BHI Soul Steppers is one way that we can do that.
Absolutely.
But it is about focusing on getting some movement in.
Yes.
Whether that's, I don't know, doing, walking in your house. You can get those apps that you can get on your phone to do stuff. But really and truly, for BHI, we encourage everybody that can to come down.
Yeah, definitely.
January.
It starts on the 10th of January, and that is a Wednesday, and we're going to be leaving from Pottenewton Park, and we're aiming for walking around the park. Well, you can do as much as you want, but we want as many people to get involved with this, and let's get healthy. And I know I can hear you saying it. You can see it already. You're thinking, oh my God, what is she on about? January, it's cold. I'm coming out when it's cold. Don't worry about that. Don't worry about that, because you know what? That's a barrier, what you're putting in front of yourself. So don't put any barriers in front of yourself. Just say, you know what? Let me give it a go. If it's not for you, at least you've tried it. Okay, all right, I'm yapping on a lot here. So that's what BHI is doing. And also, BHI is always looking for volunteers. I'm a volunteer. My name's Lesley. And look at me. I'm on the radio. How fantastic is this? So if you want to do any volunteering, then please get in touch with BHI. You can come here. It's 269 Chapeltown Road? No, 315 Chapeltown Road. You can come here, you can knock on the door, you can say hi, introduce yourself. You can give us a call on 07 34 179 8948, or you can phone us on 0113 3070 300. Woohoo! And we are here every day, Monday to Friday. Well, we're getting ready to close down now for Christmas.
I think this is our last week, isn't it?
On the radio? No.
All right.
Because on the radio, what you're going to be listening to is pre-recorded shows. Yeah, so if we're not here, you will be listening to a show. But anyway, let us play some music on this radio, and I will introduce you to our special guest in a few moments after this song, and it's all about Destiny Child. Independent woman. We like that. Yes, enjoy. Woo-hoo! Don't you just love that song? I am going to say woo-hoo to all you independent women. Woo-hoo! Innit, Marcia? Go on, women.
Yeah, absolutely.
We are amazing.
We are amazing.
High five to us. Honestly, because we do so many things. We do so many. We work, we look after the house, we're always doing something. And exercise, we're looking after everybody.
Yeah.
That's what we're about.
I think that's what happens.
Yes, and
for
now
a lot of us. Yeah.
Exactly. So that song was going to all the excellent independent women. In fact, you know what? We'll have some men in there as well, because there is some independent men out there as well. You can't just leave it all to us hot, sexy, independent women. We've got to, recognize the men as well. So to you as well. So, without further ado, let's bring on our special guest today, who is going to be talking to us regarding fertility. And here she is. Welcome, Pauline. Thank you so much for joining us today. In fact, Pauline, I'll let you introduce yourself to our audience.
Okay, all right. I thank you both for allowing me on this platform. Hope you can hear me okay?
We can hear you loud and
hear
clear.
you. Perfect.
Good. Right, it's a great opportunity to join BHI and yourself, Lesley and Marcia. This is a fantastic platform. So, a little bit about me. My name is Pauline, and I grew up in Leeds, and my career has been in reproductive medicine. So another word is assisted conception, but all in all, it's all about fertility. And I think you've got it right, actually, Lesley, when you said it's infertility, but I'm going to be looking at fertility as a whole, or I do look at fertility as a whole. But fertility affects 1 in 6 couples or individuals. So it's a lot of people out there who have had some experience and struggles in becoming pregnant. And there's lots of different reasons for that. So hopefully over the next couple of weeks and months, we'll be able to look at different sections and different aspects of infertility or the struggle to conceive. But a little bit about me. Yeah, I grew up in Leeds. I started my career in St. James's back in 89. So it's a long time ago. And it's kind of started because I was a theatre nurse, and I assisted one of our surgeons in doing the first egg collection in Leeds. Didn't know anything about it. It was very new. Louise Brown had only just been conceived around that time.
Right.
So everything was really up in the air. Not a lot of information, not a lot of knowledge. And so I started as a theatre nurse in gynae and peds, and then went into family planning, stroke, infertility. From there, and it's 35 years later, I'm still in the job, still in the field, and thoroughly enjoy it. There's been lots of changes. Back in that time when I started, we were doing egg retrievals, or we called them egg collections. We were doing them abdominally. Now it's all vaginally, and there are so many other techniques that have sprung up across the world, looking at how we can improve couples, individuals, sexual health and conception methods. We've just widened the field to explore, or for couples, or I say couples and individuals because you don't have to be a couple to have fertility treatment. You could be a single woman, you could be a same-sex couple, you can be a gay couple. So it's open to all. Think about the human rights and the Geneva rights. Everybody has a right to procreate.
Absolutely.
So it's open to everybody.
Yeah. So sorry, Pauline. What happens then? What happens? So somebody comes to you and they say they've been trying to have a baby for, I don't know, just say 2 years.
Yeah. 2 years is usually the good marker. You know, if you went to your GP and said you've been trying to conceive, they'll say, keep trying, 2 years, 3 years, keep trying. Then they may start some investigations. Depending on how much that GP or that GP practice knows about fertility. But a lot of them aren't specialists on reproductive health. So they tend to just say, well, you're healthy, you're young, you can still try and keep going. But they don't explore what could be the problem. So that could delay somebody getting pregnant. But Lesley, you started off by saying what happens when they're trying to conceive. There's so much behind the scenes before that.
Yeah.
Knowing about your own body, how healthy you are, looking at your lifestyle, smoking, alcohol intake, it can have an effect on fertility. So can your weight. So can your underlying health issues. So if you've got hypothyroidism, then that might prevent implantation. If your hormone levels are imbalanced, that can cause a delay in conceiving. If you're not having intercourse at the right time, that definitely prevents you from becoming pregnant. And these are the kind of sexual health information that we should have had way back at school rather than preventative measures. Yeah. We should know when the right time to avoid pregnancy because of ovulation. Absolutely. You know, some women don't have periods. Some women, they're called anovulatory, so they don't have periods maybe 2 or 3 a year. And the underlying condition for those women is something like called polycystic ovarian syndrome, right? Marcy's nodding, so you've heard about that?
It's quite, actually, it's probably a lot more common than we think, isn't it?
It's what, sorry?
Do you think it's a lot more common than we might think?
It is very common. It is very common. But to somebody who doesn't have periods and has never had regular periods from when they were 12, that's normal for them. And they think it's normal for everybody else. So you don't find out that it's causing you a problem till when you are trying to become pregnant. So it's learning about normal periods, normal bleeding, the right time to look at when you want to ovulate or expect to ovulate, best time for intercourse. But yeah, so there's all the delay in conceiving is sometimes down to lack of knowledge of your own body, and for the men as well. If we find that men, different cultures as well, smoke tobacco, smoke cannabis, take illegal illicit drugs, absolutely has effect on sperm, has effect on the sperm quality, on the sperm count, how the sperm move, how the sperm is shaped. There's an underlying myth that if you've ejaculating semen, you've got sperm in there. That's not always the case. So you need to know what your sperm count is as early as possible. And it's unfortunate that, well, or fortunate, men can go on and procreate into their 70s and 80s because sperm regenerates every 72 days. So every 3 months, a man's sperm is reproduced. I call it way back in the production line. He gets a new batch of sperm out. Unfortunately for women, young girls and women, we're born with the stock of eggs that we've got. So, in fact, the eggs that we have are older than us because they were generated while we were fetuses in our mother's womb. So they are older anyway. We don't get new eggs. We don't get new stock. We don't make new ones. So you're born with about just under 2 million eggs at birth. But even by the time you get to 11, 12, we've lost a third of those eggs anyway. So as we get older, the myth is fertility drops at 35. It actually drops a lot quicker, or can drop a lot quicker. And we lose the best quality of our eggs earlier in our reproductive years.
Can I just can I just stop you there, Pauline? So if people... How do people find out this information? Because just say it's somebody at that, I don't know, they were 18, they knew they wanted to start a family, but then they want to just carry on with their career, go and do their studying, or, whatever. So at that stage, are they able to save some of those eggs?
Yeah,
Okay.
Yeah, you can do. But the first thing to find out is what we call it, egg reserve is. All right, so that's a simple thing you can do. Now, I work in as I said, I've been working in reproductive medicine for over 30 odd years now, but I now work in a private clinic, and I love my work, and I've been in this clinic for 10 years. So it's really surprising how quickly time goes. I still work there, but I've actually started my own private company and help to provide information, guidance, advice, for anybody who's interested in finding out about how young their fertile life is or how much fertile life they've got. So you can contact me. We'll go through the details of how to reach out to me later. But contact somebody who can give you that information. And at the end of the day, really, all it is a blood test, first of all, a history taking, a blood test, plus or minus an internal vaginal scan. And that looks inside the body. So the blood test measures your ovarian reserve in a level. So it's a simple pinprick test, or go along to a fertility clinic, and that will give you an idea. Now, it depends on what your age is at the time you present. We have a guide as to what we think your ovarian reserve markers should be, and that will tell you whether it's low for your age or suitable for your age. Or yes, you don't have to worry about conceiving right now. But yeah, I think you hit the nail on the head. The important thing is for women to find out what the fertility is. And if they are not ready to start a family, preserve your fertility now.
Wow.
because
Yeah.
it pays to do it now because it will cost later on, and it's extortionate amount.
Yeah.
I'd be really interested, Pauline. What do you think are the most common sort of misconceptions then about fertility that you've come across, whether that's male or female?
I think the highest on that level is you can conceive anytime you want. When you're ready, you can have a baby. I know I'm young. I don't smoke. I don't drink a lot or too often. But yeah, I can conceive when I'm ready. I can start a family. But that's not always the case. It is for a majority of the people, but as I say, fertility difficulties are increasing. And those are only the numbers that we know who approach a clinic or approach a doctor. There's many out there who don't want to conceive, so they're not finding out if there is any problems right now. You know, it's the unknown that's out there. So the main misconception is the stats that are out there saying 35, you can conceive quite easily, simply, within a period of time. But after that, you might need to seek help. I was just watching Loose Women on the ITV, and Charlene White was on there saying that she was an elderly gravida when she had her children. So, you know, there is a myth out there that we can go on and conceive when we're 40, 41, 42, 45, but there are difficulties in conceiving. Because by that time, our eggs are older.
Right.
Yeah.
Right.
They're less healthy. And if, you know, it works and women can conceive naturally without assistance, but by that time, the body is only given what it has left. So if your eggs are older, there is a higher chance of having miscarriages if pregnancy follows conception. So it's really knowing what you have left, your fertility wealth, as I call it. Find out your fertility wealth right now. And then you can decide on what you want to do, when you want to do it, and if you need to do anything. Yeah, there are some women who probably are in a relationship right now. So what do? Do they go out and find their Mr. Right there and then? Which we know it's not the best thing to do. We don't settle. We want the best for us. So, you know, if you feel that you aren't ready to create a family, but feel that your fertility is on the downward spiral route, preserve your eggs.
Wow. So
Yeah.
what age would you say then to preserve your eggs? Because it just seems...
As young as possible.
Wow, okay.
As young as possible, because the younger you are, the healthier those eggs are. Now,
Paul,
I think...
can I just ask why this information, because like you said that when you're at school, you get told about, you know, how to prevent getting pregnant. And now you're telling us, you know, to, you know, preserve your eggs. So why are we not having these conversations? You know, why they're not out there?
That is a question. Now, as I say, I work in a private clinic, and I know she won't mind me mentioning it. It's Create Fertility. And Professor Nargand is the CEO of that company. And she's always been passionate, and still is, about education and trying to get in schools and colleges a curriculum where we talk about fertility difficulties and issues and raise awareness from when, you know, we are young, both male and female, so we can make an objective decision as to what we want to do. If we know that there is a test, if we know that there are investigations and you want to find out when you're 18, 19, 20, there is a place to go. But education is the key.
Right. But can you go to your doctors and get this information? Why are they're not giving out that information?
If you're not unwell, there's nothing that they can advise you. Well, they wouldn't advise you on anything if you're not ill.
Yeah.
If you are trying to conceive and you're 18, 16, would you go to a doctor? Probably not.
No.
That wouldn't be your first port of call. And the advice they will give you is, you know, just keep trying, you're young. And it's the correct advice, you're young. They wouldn't instigate investigations. In fact, fertility treatment in a clinic, whether it's an NHS or a private clinic, you should be 18 and above. Right. All right. So, and we don't have many 18-year-olds that come forward and say, I want to pay for fertility treatment or I want to go on the NHS, because there is no need to. However, if you're presenting with a young girl who is under 21 but has had 2 ectopic pregnancies and has therefore lost her tubes, she'll never get pregnant without fertility treatment. Yeah. So it depends on the etiology or the cause of the reason for your infertility as to whether you will get assistance, advice and guidance or even treatment under 21.
Right. Okay. Well, Pauline, we're going to take a short break now. I'm just going to go ahead because we are on a radio show. So we're just going to play some music and we're going to come right back to you, Pauline. Thank you so much so far. And let me just let our audience know. Right. So if you've got any questions or you want to ask anything, or you've got concerns yourself, then get in touch with BHI. We want to hear from you. We want to hear your thoughts and and see what you're thinking, because for me this is a very interesting conversation. I never when I was that age, well, when I wanted to have a baby, I didn't really think about it. So what about yourself, Marcia?
Absolutely. I don't think I really thought about it, but I did have some issues. I had a condition called endometriosis, and I was told by the consultant at the time that the likelihood of me conceiving again was slim. Mm-hmm. And I remember feeling at that time, I did actually since go on and have more kids, but I remember the whole kind of sort of emotional and psychological effect that it did have on me, because it was like, it's one thing when you're choosing to go on the pill and not have, but then when you're not in control of your own fertility, then that's
exactly,
that's another game altogether. And that was something that I wanted to speak to, to bring to you, to Pauline.
Yeah, definitely.
But we'll talk about that after.
Definitely. That'd be really interesting to talk about the pill. But so our next song is going to be, I love this one, a bit of Michael Jackson. Who loves Michael Jackson? And it is Girlfriend. I hope you all enjoyed that. That was so cheesy. I just had Tasha coming in and saying and laughing, thinking, this is so cheesy. It's like, yes, it is. Girlfriend. Remember that song? Oh, it was so cool back in those days. But and that is just a reminder of when we've got our girlfriend, our boyfriends, and, we're thinking about having a family, but we're not thinking about fertility. We're not thinking about that. We're just assuming we can get pregnant. You know?
Absolutely. And I think,
And we've got a special guest with us today. For anyone who's just joining us now, we've got a special guest. She's not in the studio, but she is here and she's going to answer all your questions. So if you've got any questions you want to ask, then please just get in touch with us on 0734 179 8948, or you can call us on Leeds 0113 307 0300. Okay, let's get back to our conversation. I know Marcia had a question.
Thanks, Pauline. So, just before the break, we were just talking about, from my experience, being told that I couldn't, the possibility of me having any more children would be slim, and how that impacted my own mental and emotional health. Thinking it's one thing when you can control your own fertility by taking the pill or using some sort of contraception, but to not have any control over that, then that's a different thing. So my question then would be, how do you address the psychological and emotional impacts of infertility when you're dealing with your clients?
Wow, that's a nice question.
Addressing how to come to terms with childlessness.
Okay.
And taking away removing that.
Sorry, Pauline. We just had a few technical problems, so I know Marcia asked a question, and so if you couldn't hear us before, I do apologise. Marcia, if you just want to just say your question again, please, and then Pauline could answer that.
Okay, yeah. The question really was, how do you help your clients, deal with the emotional and psychological aspects of infertility if they're not able to have any, if they're not able to conceive, should I say?
Yeah, knowing whatever the diagnosis has been for them, knowing that you can't have children is devastating. They have to face the fact that they're going to go through life without having children. And it's not only an effect on them, it's an effect on their immediate families as well. All right, so their parents will never be grandparents. Their siblings will never be aunts or uncles. So they often feel that they've let themselves down as well as everybody else around them. Then it's a kind of acceptance in society. Do they fit into society? Will they ever be invited to birthday parties for younger ones? Do their friends kind of not include them in general get-togethers? So it's a kind of an isolation if you're, end up being childless. But the important thing is having support around them, having appropriate counselling to allow them to reach a point where there is acceptance. It may never be an acceptance to childlessness, but there are some good support groups out here around now that are helping couples who either have chosen to be childless or have had to, because of the conditions, be childless. I talked a bit about having children with their own genetic link. There are other ways that you can have children, but it means using donated gametes. If it's a male factor, where the sperm count is low or there's no sperm at all, then there is a chance that they can use donor sperm. Or if it's a female, they may be able to use eggs from a younger individual, younger woman, to try and conceive. So all those aside, there's also surrogacy if a woman cannot safely carry her own baby. So there are other ways, but not everybody wants to explore those. So being told that you cannot, or the chances of you becoming pregnant are very, very low, is devastating. Now, as I said at the beginning, we don't see those couples because they've left our services. But there are some really good supportive support groups, forums that they should, and we do direct them for the help and support.
I think that's really really important, that and you've just said that that's what you do. So even if you don't necessarily do that, you can point them into the right direction so that they're getting the information that they need, and that's really important. Getting the resources and the support that they need. And you have already touched on some of the current options that people have for wanting to conceive, but one of the things that I wanted to ask as well, some of the other options. What can we do for ourselves in terms of, and do you think it even works? When we're talking about things like alternative therapies, complementary approaches, to fertility that we might want to consider alongside traditional medical treatments. What are your thoughts on that?
Yeah, there are so many things out there, so many alternative therapies and therapists who will advise and guide. And again, it comes down to what the cause is. Now, I say it's a great opportunity to be on this platform. And what I'd like to do in future appearances is break down the causes of infertility and have a topic each session. That way it will be able to address the diagnosis, the investigations, the treatments, alternatives, and moving forward. So, but in general, you can Google infertility, treatments for infertility, and you can come up with herbal remedies and alternative medications or some kind of other treatments that are out there, and they are wide and wide variation of treatments. Some I definitely wouldn't recommend because we don't know the true scientifics behind them as a whole and what they're going to do to your body.
Okay.
But the healthy side of it is absolutely important. Keep yourself healthy. Good diet. Lots of fatty fishes and fatty oils. And ensure that you're taking your vitamins and multivitamins. And folic acid is very important. Once you know you're considering trying to have a pregnancy, avoid fatty foods. So stay away from the certain takeaways daily. It doesn't have a good effect on your body. It increases cholesterol and dampens down the actual hormone function. There's very little that's recommended out there in the market for sperm factor. The sperm conditions of sperm is whatever the presentation is. So you're never going to improve the sperm quality or count or morphology, but you can improve the lifestyle of the male by, again, multivitamins, even folic acid as well, zinc. And the important thing as well is diet.
Right.
Having the right diet, healthy diet, balanced diet is very important. They've got the superfoods out there, or berries, and as I said already, and the vitamins. They're very good for general health, well-being of your gametes, your eggs and sperm. But yeah, smoking is definitely a no-no. It slows down the response and activity of the sperm and the quality of the eggs.
Can I just clarify 1 second? One thing that I wanted you just mentioned, particularly for the male, around sperm. So I mean, I may have misheard, but are you saying then that even when we take into account nutrition, looking after yourself, all of those things, and exercise, will that actually have an impact on the quality of the sperm or not? I can't quite remember. I think I may have missed what you said.
She said, yeah.
Yeah.
Yes, it will.
Good nutrition, does improve your health in general.
Right.
Now, if you're feeling really unwell, all right, and I can see a patient coming in, and I'll say, "Oh, are you okay? Are you well?" Because they look drained, they look gaunt, and they'll say, "Oh, I've just had a really bad infection or some injury, and it's caused an infection," and that's inflammatory disorders internally, and that does have an effect on the sperm, because if your body is not functioning to the best of its ability, neither will you.
Absolutely.
So they would advise them to take antibiotics to remedy their condition, their inflammatory condition, and then just have a rest from trying to conceive for at least 3-4 months until your body's regenerated again. But yeah, so health is important, knowing your body is important. And another thing, stress and fertility do not go well together at all. And that's the worst thing, because they're stressed because they can't get pregnant.
Yeah.
So it balances out. They may be stressed because they're having to work extra hours, extra long hours to find the funds to pay for a treatment.
Yeah.
So, everything it circulates. But the most important is a healthy diet, avoiding recreational usage of drugs, avoid steroids, avoid those power medications for, the men that go to the gym, that knocks your sperm completely off the radar.
Right, okay.
Yeah.
That's interesting.
Right. Pauline, we're going to break now because we've got the news coming in at 3 o'clock. So we're going to be back with you in the next few minutes. Okay. Thank you. All right, to our audience, we are going to be back in the next few minutes. And let's just find out. Yes, we're going to carry on our conversation with Pauline and hopefully find out, well, I mean, it's going fantastically well,
Yeah,
but
it's
find out more information to do with our fertility. So, yes, that's brilliant. And we'll be back in a few minutes. Thank you so much. Let me tell. I'm going, and I haven't even played your next song. Let's go Off the Wall with Michael Jackson. We're back. That was Michael Jackson, Living on the Walls. On the wall. Michael Jackson. What a cool song. Don't you miss him? I miss him. I love his music.
Do you know what's really interesting? It's like nearly every generation are always fascinated by him, isn't it? Even the kids now. Yeah. The little ones think he's amazing.
Exactly. Yeah. Oh, no. We all need a bit of Michael Jackson in our lives. Definitely. Yeah. Welcome back, everyone. My name's Lesley, and I'm here with the BHI show on Passion Radio, and I'm here 2 till 4 o'clock every Thursday. Please tune in and share the app, download it. If you know somebody and they want to listen in, then download the app for them if they can't download it. And just tell your friends what's happening on the radio. On a Thursday between 2 and 4, you've got the BHI show. We've got different activities going on, so please get in touch with us. Send us an email, give us a call, knock on the door, come and say hello, introduce yourself. If you want to do any volunteering, then don't be shy, because I'm a volunteer and I'm on the radio. Hello. So if you want to just join us, then don't be shy.
Absolutely.
Marcia, hi, welcome back.
Thank you.
How are you enjoying the show so far?
I'm finding it really fascinating, actually. Yeah.
Yeah, I think it's really interesting. It's so nice to have Pauline with us. We've got Pauline Bennett with us, who's talking to us about fertility. So, Pauline. Hi, Pauline.
Hi. Good afternoon.
Welcome back.
Yes. I just wanted to say, you were talking about at the beginning of the show, is it the 12 steppers? The walks?
BHI Soul Steppers.
Soul Steppers, right.
Yes.
Yeah, that's a good thing to get involved in.
Yeah, definitely.
Exercise is good for the mind.
Absolutely.
And for the body as well.
Absolutely. Yeah. So, Pauline, so I've got a question for you.
Yes.
My question is to do with males. So I know of somebody who had an operation and had to have one of his testicles removed because it had twisted in the bag.
Oh yeah.
And so would an operation like that prevent a person from getting, what's the word? Conceiving.
Yeah. Obviously, I'm not going to ask you too much about this person, but are they of the reproductive age group?
Oh, I'm not sure.
Yeah, they will be.
Right, so it depends. Yeah, yes. You're right, it depends. Now, hopefully, before you had the surgery, they would have discussed the risk. That's the important thing. And going back to what Marcia said, it's informative. Right. Having informative consultations, counselling to discuss the risk. But yeah, if you're a gentleman and only have one testicle, it doesn't prevent you from conceiving and trying to, have a family. But the important thing is how healthy your sperm are. And as long as you can still reproduce new sperm, then yes, you can conceive. But depends on what your count is. So again, go back to know your fertility wealth as well as your fertility health.
Wow.
So a sperm test, which is simple to do. Yes, a little bit, it could be embarrassing because you have to go and masturbate, ejaculate into a container, which then gets passed over to be assessed by a professional. So they count the numbers of sperm. They watch how the movement of the sperm is evident under the microscope. And they check and see how many of the sperm seen are healthy looking. We call it forward progression. So they're going in one direction rather than swimming and chasing the tail. You may have millions of sperm, but if they're only going round and round in circles, they're never going to get to that egg to fertilize it. So it's knowing how the sperm function, how many there are, and what kind of condition they're in. Yeah.
Okay. I've got a question, Pauline. I wanted to know, are there any specific disparities or health challenges when it comes to, to people African Caribbean heritage, people of colour, as opposed to the majority population here? Are there any differences? Is there anything specific to us as black people that is different in terms of our fertility?
Yeah, there are. There are some cultural differences, and there are some kind of well-known disparities between women and the health of the womb. Now, we know fibroids is prevalent in Afro-Caribbean women.
Yes.
And these can cause problems when you're trying to conceive. Depends on where the positions of the fibroids are. If they're right in the middle of the womb cavity where a pregnancy could implant or should implant, then yeah, that could cause problems. But there are a higher percentage of fibroids presenting, shall I say, in black and Afro-Caribbean women, other than the Caucasian or Asian women. Okay. Why that is, we don't know. That's one of the obvious cultural differences. When women who have polycystic ovaries, they tend to be generalized throughout, but a higher number in the Asian population. Okay. And that could be down to the diet that they have. So their diets are usually rich in oils and such. So they think that because polycystic ovaries is some of the factors on that is an ability to break down the cells. So a high number of women who are from the Asian population also have diabetes. So the insulin resistance is higher in that area. Right. So PCOS is quite high in the Asian population. It doesn't rule out any others, but it's a higher number. Where it comes to sperm, no, there isn't any difference really other than the health of the sperm. And that could be characterized with, again, the non-Caucasian population don't expose themselves to as much recreational intake of marijuana, cannabis. It's more prevalent in the Afro-Caribbean population.
Wow. Okay. Wow.
That's really interesting. Yeah, absolutely.
You were saying, Pauline, about different, like coming back on the platform and talking about, different subjects. What do those subjects look like? What can we expect to talk to you about?
It's what I'd like to find out is from the audience as well as to what they want to know. So it'd be good to get feedback.
Yeah.
But if we presented and broke down fertility or infertility into segments, that might make it a little bit more easier to understand or raise awareness of.
Yeah.
So I'd like to talk about causes of infertility, right? Because there are many factors that can cause or prevent you from conceiving. They could be female factors, they could be male factors, they could be related to age, they could be related to genetics, and there could be a joint issue. The female factors, I think Marcia have mentioned endometriosis, there's polycystic ovarian syndrome, there's tubal factors, there's the presentation of the womb, how healthy the womb is, including endometriosis in that as well. And then for the men, there's different aspects of the sperm analysis. So we could talk about male factor in one session, and that'd be quite interesting to get the male perspective on that. Then we can talk about what can be done, what investigations to find out where or if there is an underlying factor, and then what treatments can follow. Because there are different treatments associated with different aspects of fertility or infertility. So there's different areas. And then we can branch out into looking at the wider aspects like egg donation. What does it involve? Who would it concern? Who would be entitled to think about egg donation? What is an egg donor like? There are egg and sperm donors. So there's donors who donate anonymously to somebody who unfortunately hasn't got sufficient eggs or sperm, and then there are couples who need to receive donation from a sperm donor anonymously or an egg donor, and look at what they need to go through. what treatments are involved. And then we can look at surrogacy and what surrogacy is. I don't know if you know what surrogacy involves.
Well, you're the expert, so I'm going to leave it up to you. Sorry, go ahead.
I mean, is surrogacy really common here in the UK? I tend to sort of hear about it. It is.
Yes, it is.
Oh wow.
This is.
Oh, tell us more.
Yes, surrogacy and even egg donation, sperm donation is quite prevalent in the UK. It seems to be very popular, surrogacy, because there's two methods. There's two aspects of surrogacy. There's the medical surrogacy or social surrogacy. Now, you might ask, well, what's medical and what's social? Now, medical surrogacy is where the female who's trying to conceive or wants to conceive cannot has no ability to carry the pregnancy, the baby themselves safely to term. So they will need some intervention. So somebody else replaces her womb, ineffective womb, or this social surrogacy where it might be a choice not to carry their baby.
Yeah.
And where would that fit in? I'd say somebody who doesn't want to take time off or can't take time off for pregnancy, maternal care, aftercare and such like. And they tend to be your celebrities who haven't got time, your film stars.
Wow.
They're filming, they can't get time off, they don't want to ruin their body, their shape, so they go for social surrogacy. So in the UK, medical surrogacy is what we support and treat. But it's more prevalent in the America, where social surrogacy replaces the time.
I've got some questions here for you, Pauline.
Lovely.
Some from people who have called in. So thank you so much, everyone, for being a part of the show. We really appreciate that. So your first question is: Can you tell if you could have more infertility from a young age? Is that right? Have I read that right? Can you tell? Yes. Could you tell?
Just to repeat the question again, can you tell if
you could have infertility
from a young age?
Yes, you can. You can. Again, it's a simple assessment, and that one of those is a blood test, or that's a physical measure of your hormones. Okay. And the blood test is called anti-malarial hormone. So you just draw a little bit of blood, and that gets processed. What comes back is a marker. So it gives you a level in numerical form. So you have a number, and it will tell you a high number or a low number. That will give you an idea what your ovarian reserve is. Somebody like me who is quite old and past fertility and reproductive years, mine will be very low because I'm not trying to conceive. But if I had a 20-year-old or a 23-year-old, I'd expect her AMH level, anti-malarial hormone level, to be, 60, 70. Now, if it comes back as 10 and 12 and 5, she's in trouble at that age because her fertility is plummeted, and there aren't many eggs. So that's a simple blood test that you can take for a female. So if the blood test comes back and it's not consistent with her age or her history, I would advise her to have an ultrasound scan, which is an internal scan, to actually physically see that the ovaries are there, because she may not have ovaries anyway. Yeah. So it might be a genetic disorder. And if the ovaries are present, where they're situated within the pelvic region, and what their follicles, or we call egg sacs, how many she has. So each month, a egg sac grows, develops, and matures an egg, pops, finds sperm, we get pregnant. So how many egg sacs does she have left in her ovaries will tell her what her fertility is like. So in my company, I do everything on Zoom. So I get an introduction, take a history, find out a little bit about themselves, if they've been pregnant before, how long they've been trying, if they've been trying, are they in a relationship, Generally get a feel of what is going on in their background as well, their lifestyle, their occupation, stress levels, the diet, the BMI, because BMI is very important if you're trying to conceive. So I take a full history and then organise some various blood tests. Now, anywhere you go, you've got to be careful if you're going outside of a clinic that you're getting a reputable reading or results. So it's important to make sure that you've researched the person you're going to have your consultation with. But I use a company that is very reputable in the UK. So their the bloods go to them, they process it and it comes back to me. It's all private, it's all confidential. And then I have a follow-up consultation and go through the results, go through advice. And it's the same with the men. They can do a sperm sample, and that can be processed. The best place to have a sperm assessment is in a reputable lab, however, but there are some tests that I can organise through the company. So if somebody wants to know what the fertility is now, and they're young and not planning to have a family, but want to know, that's the best thing, is find out now.
Yeah, find out now. Just say this person's, 25 years old. So it's best for them to know what's happening now.
Absolutely, yeah.
And that's where education comes in, isn't it? Because a lot of the time they're not thinking about any of that stuff. They're just going about the business. So, education from school, like you said earlier, I think is really important.
From school or colleges, find out about your health. You're told so many times to eat healthily, avoid fat foods and things like that. We don't always follow those guidelines, but we can change our diet, can't we, eventually? We can go on a diet, or if we need to put weight on, we can increase our BMI, but you can't change your fertility. It is what it is at that moment. And it could be good in majority of cases, but I believe that fertility is dropping earlier than 35. Wow. The reason why we can't support that is we don't test routinely women who are just walking around not trying to conceive. So until they find that they're having difficulty is when they go and find out what the fertility status is. Yeah. Because if you're 25, you think, I've got loads of time, I'm not having children yet, I'm fine, I don't need to start anything till I'm 30, 35, 39, 40. But you could be 25 now and have a low fertility level, and it will get lower. I've just had a black couple who came through, and I was scanning her, and I couldn't even make out her ovaries, the structure of the ovaries. It just didn't look a normal pelvis, and I couldn't see her left ovary at all. Now, she had some surgery and had a cyst removed. A cyst is an abnormal growth in the ovary. Yeah. Can be benign, can be malignant, but majority are benign. So she had a cyst removed. But I think they've taken most of the ovarian tissue. So
was she aware of that?
Probably not. And this is the thing, you don't know. So she'd had surgery, had the cyst removed. How big was the cyst? I don't know. The cyst may have been as big as the ovary. So they would have taken the whole of the cyst and not left much tissue. Yeah. But the left ovary I couldn't see at all. Anyway, I did a blood test, and this is within my 9-to-5 job. So we did a blood test, and it's come back that it's 0.2. So she will never conceive.
Oh dear.
And she's 32.
Wow.
She will now need to go and have egg donation. So finding eggs from a younger woman who would come and donate the eggs to her. Wow. So that's another topic that we can talk about. That's been.
Yeah, it just feels. Sorry, Lesley, I'm so sorry. I didn't mean to. No, I just get really passionate about, especially when it comes to women's health. And I know it's not all about women; it's men here as well. Because I think it's important for them to have an understanding. But it's just this whole, because it's bigger than just what you've got in front of you, isn't it? Mm. It takes in so much more. Mm. There's more of a, I know they use that term holistic approach, but it's more than just what you've got sitting in front of you in a clinic.
Yeah.
It's all the, the psychological stuff that goes
Absolutely.
on. It's, the connections that you have with other people,
Yeah.
your family,
Well, it's
your
about being
partner, your husband.
Included, because, if you don't have a baby, then you might be excluded out
Absolutely.
of what she was saying. So that's what Pauline was saying. So,
yeah. It's having the information when you're having stuff done to you in hospital. So, for example, that lady, she's had the cyst removed. Was she aware that she'd lost half of her ovary or the majority of it? It's those conversations that sometimes we don't always have, and then we get a shock when something else happens down the line and we think, well, I was never told this happened to me, or they took that, or And
I think it's, no, that's fine. Don't apologise. I think it's really important, Marcia, Pauline, that we're having these conversations, because Pauline, the information what you're giving us, I didn't know this. I mean, I'm not going to have any more kids. I'm far too old for all of that. But I didn't know this, and then I'm just thinking to myself, if I was younger, I'd be taking this more seriously. Where before. When I was younger, I didn't think about it. I didn't think about, I can't have a baby or whatever. I just assumed I could, That's
the thing. We all assume it's the human right to procreate.
Absolutely.
So it's going to happen. It's going to happen.
Yeah, so I think, sorry, Pauline, I think to our audience, I think it's really important that if you're listening to this conversation and you want to get in touch, please get in touch with BHI, and we're on. You can call us. You can go onto any of our social media handles. We're on Instagram, TikTok, Twitter. You can find us on there. If you want to have a conversation with Pauline, then please email us also at Black Health Initiative, and then we will pass all your information over to Pauline, and then you can have that. That discussion with her. I think it's really, really important that we're having these conversations. I think BHI is a fantastic platform to be on. If you want to learn anything about Black Health Initiative, then, please just share, tell your friends that we're here. And if you've got any questions, then, just fire away. Okay, thank you. Thank you so much, ladies. I think with that, we're going to take a little break. And because I think you've given us a lot of information there, Pauline. And it's just, I know we're gonna definitely, come back. You definitely need to come back on the platform.
Absolutely, yeah.
And it'd be really nice for you just to touch on about, do people need eggs? Don't answer that question yet. That's the question what we're going to have. As soon as we come back, we're going to just take a little break. We're going to play a little song. What song are we going to play? What should we play, Marcy, to our audience? Let's find a song, and then we will be back in this conversation, which is so fascinating. It is so interesting to have this conversation. And what I was just saying, I never thought about it before. Never thought about it. So, it's brilliant. But anyway, let's just change the mood. Guess who was in London? Who was in London from America this week, last week? Oh, sorry, this week. And she was in King's Cross, and she was playing. Do you not know?
No.
Do you know, audience? Who was it? Alicia Keys. Here she is.
I keep on falling.
Wow, Alicia Keys. How fantastic is that? Falling. That is such a nice song. And she surprised people. She was in London Pancras this week. Okay. She was there and on the piano, and she was brilliant. I do like Alicia Keys. But anyway, hi everyone, we're back. And can you believe it? It is 20 to 4 already. 20 to 4.
Wow.
And we have only got 20 minutes left with our special guest. We are having a conversation all about fertility, which has been absolutely interesting. And I just want to say, Pauline, honestly, thank you so much. It has been real education. a real education and just what we need. Marcy, what are your thoughts?
No, I think it's an important topic. I think we need to have this education from school right through.
Absolutely.
I think it should be part of the curriculum, because I think I can't remember what. I think it is in there, but it's how it's taught, isn't it? I think there are certain things that are mandatory, but we need to use that more, because I think it's open to interpretation. But I think if we specifically say, we want stuff around fertility, it should be embedded in in the curriculum, because it's important alongside other stuff as well, sexual health and, and everything that's connected to it, which is for a different time, I guess, but, things like relationships and, how you navigate those. So all of it is interconnected, but it's a very, very important topic. So thank you, Pauline.
No, definitely. And to our audience, thank you so much for being a part of the conversation today. I hope Pauline has been able to answer all your questions. I know we had one here, Pauline. Is there an age? But I think we covered that. Is there an age which your fertility happens?
Well, yeah. Your fertility comes into effect when you are looking to conceive, when you're looking to start a family, or you're wanting, which you touched on before, think about preserving your fertility. And that goes for males as well as females. There are some health conditions that should encourage our clinical professional bodies to talk about fertility preservation, particularly in the cases of young cancer sufferers. If there are young men who have got diagnosed of cancer at the age of 16, 18, even younger in some cases, to have that conversation, that discussion about saving some sperm pre-chemo treatment. If there are young women out there who have had cancers, different parts of cancers in different parts of the body, not necessarily the ovaries or the womb or the cervix, to talk about preserving fertility. Because once you've exposed to the radiotherapy, chemotherapy, you are killing your cells. That's what it does. Wow. And it then deprives your sexual organs from functioning. So the fertility is non-existent after they've had exposure to radiotherapy. So it's very important that our supportive network are aware of the issues of fertility in future. Yeah, cancer is unfortunate if it happens in a young adolescent. However, if you take away the opportunity of discussing with them, do you want children in the future? Then, you will never get that back again. So fertility preservation and trying to conceive is very important to consider at any age, but also at a young age. You don't have to be trying for a family, just need to be aware that your fertility is an issue.
I'm hoping that they would have those conversations if you've got cancer, I'm assuming you would have those conversations with your doctor.
We assume that as well as a fertility field. Right. However, it doesn't always happen. And it could just be the time frame that's limited to the cancer support network. If a diagnosis is made 2 weeks ago, there's a 2-week turnaround time. If a diagnosis is made, they may not have enough time to then involve a fertility expert, a counsellor, an advisor, and then get them through to treatment. Plus, if they are younger as well, it's the consenting to store their gametes, which is an important pathway that they've got to follow. Sperm and eggs and embryos can be stored for 55 years. Wow. And that provision is being put in place to incorporate the facilities of fertility preservation for cancer children or young adults, so they can store for that period of time. I know that's another area that I'd like to talk about is the legal aspects. I mean, the legal aspects of the reproductive world is mind-blowing. It's mind-blowing for us as clinicians, so we can understand how it is for our couples coming through. gametes and the preservation and the handling and the use is very, very important thing to consider. And not a lot of people are aware of it.
Yeah, Pauline, wow, this is so interesting. It's fascinating. And yeah, why are we not having these conversations? But I'm so glad, I'm so happy that you are on this platform with BHI. And it's BHI show 2 till 4 with Passion Radio. And please share this app with your friend, family. Have those conversations. If you've got any questions, then please get in touch. Don't be shy. Get in touch with BHI. You can follow us on all our social media platforms and just give us a shout out. Just let us know. So, Pauline, yes, we've covered all the questions, and thank you to everybody for being a part of the show. We really do appreciate it. But Pauline, before we went for a break, we was having a conversation about eggs donation. Is that really popular, or what's that about?
Well, having to think about receiving eggs from another source. So you're looking to have a pregnancy, start a family with a gametes that's not biologically yourselves. Again, we look at the psychological aspect of that. The adaptation to having treatment using somebody else's eggs. How does that make the woman feel? The effects of feeling possibly a failure because her body's failed her. She hasn't fulfilled her most ambitious role to be a mother to her husband, her partner's child, and to follow and to continue the family generation. So that aside, which is a very important thing, and it should never be put aside totally, we do have the services of having donation. And this is where if your eggs, and it could be a genetic reason as well as low ovarian reserve or ovarian failure, that you need to consider using eggs from a younger person or another person. That's called altruistic egg donation. All right. So what we look for is the generosity of a younger person, another female coming forward and donating her eggs to an anonymous source. So the egg donor, which we'll cover in another program, obviously has to fulfill the criteria. They've got to be healthy themselves. They've got to ensure they provide a good, clear medical history, and they've got to prove that they have got ovarian capacity to be able to donate some eggs to this woman. Ideally, the egg numbers to receive is about 6 to 12. So in one stimulated cycle, IVF cycle, she will have medication and then go for a minor operation. We extract the eggs from the ovaries while she's asleep, and then they are donated to this couple. Now, there is a lack of egg donors in the UK. Absolutely lack of egg donors. And there are less black egg donors in the UK. In fact, hardly any. In the time I've been in reproductive medicine, and it's over 30 years, I can count the black egg donors on one hand that we've had come through.
That's really interesting.
What's the age? What age can you go up to? You said that you saved them for 55 years, but what age can you go up to donate?
To be an egg donor, yes, you must be between 18 and 35.
Right.
Okay, to be an egg donor. And then obviously we do the test investigations to see if you do qualify. So you've got to have a healthy lifestyle. Okay, so between 18 and 35 you can donate in the UK. It is, I call it altruistic. So the recipient never meet. They're totally anonymous. However, the changes in the laws that came into effect in 2005 means now that their information, the donor's information, can be accessible to a donor-conceived child. So a child born through the donation. So that changed in 2005. We lost a lot of donors off the books, eggs and sperm donors, because they were unsure about that knock on the door and how it would affect their life. Before it was totally anonymous, or it's totally altruistic, they donate and then they walk away and carry on with their life. but now the law's changed for the better. We've come to realise, because it's brought it in familiar with adoption law. So when they're 18, they can seek some more information about their donor, their gamete donor. So the changes, and I'll explain that in another session. So because there was this change in the law, we lost a lot of donors, but we never had black donors coming through anyway. And again, I think it's because of the lack of awareness.
Yeah.
Right?
Yeah.
You didn't,
Yeah.
you know, our population, our community didn't know that they could donate. We have even less Asian donors. So Caucasian donors are the ones that were coming through. So couples, black couples who needed egg donation, what do they have? White eggs. Wow. And that's where, but you're diluting your own culture.
Interesting.
You know, you're possibly going to have a child which is a lighter skin. Will that be acceptable in the community that they live in? And it diminishes the outcome. The desire to have a child was overridden by the fact that you're not using somebody from your genetic background, your cultural background.
Wow.
So there are very few still. And I want to raise the profile, because there are lots of young girls out there who can help somebody else and help them to provide the chance of them conceiving. And now there is actually a good compensation payment for egg donors, which I'm pleased for. I still think that they could reconsider increasing it, but there is a compensation. So for the time that they are spending with us, the commitment that they're making for their donation, there is a compensation payment at the end of the donation of £750. Back in the day, it was only £250, but now it's £750 that they get towards their contribution to the time that they've given.
Right, okay.
So it is, as I call it, the gift of life. You are giving somebody a gift of life.
Yeah.
And you know, you're not diminishing your own fertility reserve, if you like, because your body, if you've got still a million eggs in your body, then you can give 12 at a session, and it doesn't reduce your own fertility. So we are desperate for black donors, black females to come through, and males, black sperm donors to come through.
But what if, Pauline, there was a woman who was older than 35, and you know, if her sperm was all right, her eggs are all right, then surely she would be able to donate?
No. By law, we have to abide by the laws of our UK laws, right. And we're governed by what we call the HFEA, Human Fertilization and Embryology Authority. So they put the regulations out and the guidelines out for clinics to follow. Now, remember I said at the beginning that fertility drops at 35?
Yes.
Statistically. So those are the guidelines that they've made. So an egg donor should be 34, 35 and under, to maximise the chances of another couple conceiving. Right. You can have and choose to accept a donor who is outside of the guidelines,
yes.
And they tend to be known donors.
Yes.
So if you have a sister, a best friend, or some close relative that you wish to bring forward, you understand that you are reducing your chances of conception because they are outside the recommendations, the guidelines, then we'll obviously have that conversation with you and advise you accordingly. But yeah, sister to sister donations tend to fall outside of that, and then we put a case to the governing bodies and ensure that it's okay for us to do. But yes, we want to maximise the chances of a pregnancy, so we wouldn't go outside those recommendations.
Okay.
But a lot of donors come through who want to donate and find out they actually have fertility issues themselves.
Yeah.
And can't.
Wow.
Yeah.
You know what, Pauline? It has been an absolutely fantastic show. And I cannot believe 2 hours has passed by already. Okay. So we've got to cut it short there. And because we're 5 to 4 already, and we're going to break in a minute for the news. So, but thank you so much for coming on the platform and sharing your knowledge with us all, because it's been absolutely brilliant. And yes, to our audience, we will definitely be arranging another date for Pauline to come back on. And please,
Absolutely.
yeah, if you've got any questions, you want to get in touch, then just get in touch with BHI. Let us know what the questions are. We can pass that information over to Pauline. Pauline, I'm sure we've tagged you into a post what's going to be on our social media platforms. So
yeah,
have a look on our social media platforms, and then you will find Pauline's details as well on there, so you can contact her straight away. But Pauline, thank you so much for being on the platform. I really appreciate it. And yeah, we will talk shortly. Marcia, wow, wait a minute, I've got to let's just play our last song over.
Oh,
what a show.
I'm telling you, it was really insightful.
Yes.
It was informative. It was quite powerful, actually, because, you know, and this is what we want. It's you know, to be empowered so we can make informed choices about our own bodies and about our own lives. If we don't know, then we can't make informed choices, can we?
Exactly.
You know, so it's really good that you're able to share all of that for us, Pauline.
No, brilliant.
Yeah, I look forward to
coming back on the platform. But to our audience, thank you so much for tuning in. 2 hours have gone by really quickly. I've really enjoyed the show this week. It's been so interesting, and like I said, if you need to get in touch with us, please get on our social media platforms. If you want to do any volunteering, all on our social media platforms. Thank you so much for tuning in. We are going to play our last song before we go to the news, and it's I Feel Good, Beres Hammond. Enjoy!